Thank you, Leska Hirlock, and thank you to the Labour senators for bringing this bill forward tonight. I want to acknowledge anyone this debate will touch in this House and in all houses and people that we know and in families. The anguish that people do suffer in trying to have a child, the pain, physical or psychological, of miscarriage, and IVF and other fertility and reproductive treatments, and it's always it is so common, and yet every time you hear the number, it never fails to still shock me how common it actually is. Every circumstance and experience of fertility is different, but there should be clear statutory provisions for when it doesn't go to plan. A state safety net to support women through the challenges that they do often face stoically and silently in the workplace. All too often, reproductive health in general is hidden, and something can be personal and private, but not hidden. And it still needs to be provided for with dignity and compassion. So providing leave in these circumstances acknowledges the loss and the anguish and the trauma of women and family health, but it is also about workers' rights. And let's face it, mainly women's workers' rights, and making workplaces more realistic and fair for them. And too many barriers still exist for women in employment, and that mainly centres around reproduction. Having children and caring for them. And our workplaces are still very one-size-fits-all places. And the reality is that life isn't black and white, and there's lots of grey, and that does tend to affect women more so throughout their life stages, as you said yourself. So we do need this legislation to break down, or this kind of legislation to break down those barriers. So Ireland provides the standard 26 weeks of maternity leave and the additional 16 weeks leave for those who suffer miscarriage at 24 weeks or when a baby reaches a certain weight. But it does need to address the gap of pre-24 weeks. And we have all been inspired by New Zealand passing the Holidays Bereavement Leave for Miscarriage Amendment Act 2021 in March, providing an entitlement to mothers and their partners of 3 days leave following a miscarriage or stillbirth, which is an extension of their existing statutory bereavement leave. They provide 3 days leave for women and their partners who lose a baby at any stage of pregnancy, and prospective parents will also be eligible if the mother of the baby they were hoping to adopt suffers a miscarriage as well, and I think that's important. So time off for miscarriage at any stage should not be covered by a person's annual leave, their sick leave, their unpaid leave, or by the kindness of the employer. And it does underline the inequity of it, as Senator Sherlock did say, that you may have an employer or a job or a role that can accommodate it, but not everybody does. Time for IVF, fertility treatment and reproductive health should also be provided for, and that treatment can be incredibly invasive. And again, it's about inequity or equity in terms of access and in costs. So I agree, we do need a model of care that infertility issues can be addressed through the public health system. And I too want to see the assisted human reproduction legislation advanced. Yes, it is true that introduction of any kind of paid leave will necessitate consultation with employers, and a full regulatory impact assessment and stakeholder consultation would need to be undertaken, and that's fully understood. I want to thank the document that we got from the Irish Neonatal Health Alliance for their Oireachtas briefing on baby loss. And in their briefing they did say, which Senator Mullen touched on, that there's currently no statutory entitlement for paid leave for parents when their child dies at any other age. And I do think that's something that we need to debate and consider. I don't think, it's mind-boggling that any parent could be in the position where they would have to return to work, but to have to also return to work before they're ready. And I think that's what would have to be considered. But going back to the equity point as well, if certain jobs or certain roles or certain people don't get access to that leave, then a statutory provision would be a good instrument in that case. But at the same time, certain people react differently and may need more time. I also want to acknowledge the Kildare County Council. And the Irish Neonatal Health Alliance also included this in their briefing, that Kildare County Council has waived fees for burial plots where a baby is under 18 months old. And if a family plot is chosen, the plot fee will be equally reduced. And if they choose to bury the baby in an angel's plot, the council will also waive the fee. And I think those are just practical things that we could be doing for families to make something that's so awful a little bit better. And even some countries pay funeral costs for babies and children up to 18. Again, that's a compassionate support. That maybe this is an opportunity to highlight that as well. I'm just going to give the last word, I suppose, to the women that did go through so much pain by themselves because of restrictions to maternity services, and acknowledge the women in the north, our female friends in the north, that still don't have access to healthcare services in the most tragic of circumstances and have had to travel themselves during COVID-19. So thank you very much, Senators, for raising this tonight. And I look forward to working with the House on legislation.